Thank you, Mr. Speaker. You know, I came to the floor this evening primarily to talk about issues and opportunities at the VA and the successful confirmation of our new Secretary of Veterans Affairs, Dr. David Shulkin. But I would be remiss in not thanking my colleague from Texas, Mr. Green, for his powerful words about the NAACP and the profound positive impact that they've had on this country and on our ability to make the most of the potential that we have in every single community in the United States. And Mr. Green is well aware of the inordinate pride that I have in the community I represent of El Paso, Texas, and how the first chapter of the NAACP was started in El Paso, Texas, through the good work of Dr. Lawrence Nixon, who also has the distinction of having been the man who effectively desegregated voting in the state of Texas, ending the all-white primary, which had prevailed following Reconstruction in our state, much to our lasting shame, but to our immense pride. He was the man, and our community was the place where that successful fight began. And as Mr. Green also knows, because I had the pleasure and honor of joining him in a special order not too long ago, El Paso also was the home of Thelma White, who, along with some other young, courageous El Pasoans who had gone to the all African American high school, Douglas High School in El Paso, attempted to enroll in Texas Western College, now known as the University of Texas at El Paso, were denied entry simply based on the color of their skin. And thanks to the NAACP and one of their most promising attorneys, Thurgood Marshall, they were able to take this case to a federal bench. In fact, the bench of R.E. Thomason also happens to be an El Pasoan, whose ruling not only ruled in their favor, but effectively desegregated higher education in the state of Texas at that time and forevermore. So I just wanted to add my thanks and my support for an outstanding organization and the very positive impact that they've had on the state that I call home and the community that I am so lucky to serve and to represent. So I thank the gentleman from Texas for staying for just a little bit longer. Mr. Speaker, I am also here today to thank my colleagues in the Senate who 100-0 yesterday confirmed the President's nomination of Dr. David Shulkin to be the next Secretary of the VA at what I think is the most critical moment in the history of that critically important organization. We all know of the severe challenges that the VA and the veterans whom it purports to serve faces today. We know challenges in service-connected disability claim wait times, in the appeals that are made to those claims when the judgment or the ruling is not in favor of the veteran in question, or there is an error in that judgment, or some additional information needs to be added. Wait times in appeals that last not days or weeks or months, but are measured in years. We know about challenges in wait times for those veterans who are seeking to get an appointment with a primary care physician, a specialty care physician, or I think most critically, at a time when 20 veterans a day in this country, and that's a conservative estimate, 20 veterans a day are taking their own lives, severe wait times to see a mental health care provider. Those are among the most important challenges that we as a Congress and those of us who serve on the Veterans Affairs Committee face today. And so again, I'm grateful for the Senate's work on this issue in confirming Dr. Shulkin. And I've got to say, despite some deep disagreements and differences and disappointments with the current administration, I am grateful for this president for the public good he has done in nominating Dr. Shulkin, a man who has served in previous roles as CEO of Beth Israel Medical Center in New York City, chair of medicine at Drexel University College of Medicine, and beginning in the summer of 2015, the Undersecretary for the Veterans Health Administration, where he hit the ground running, began working on the challenges before us, providing solutions to them nationally and in our individual congressional districts, on the ground, working with the teams there, both at the VA, in the public and private sector, and with the various representatives who brought these issues to his attention. So could not be more grateful for his service, and I want to speak about that a little bit more. But I also want to acknowledge that we have some excellent leadership on both the Senate Veterans Affairs Committee and here in the House, where Dr. Phil Rowe of Tennessee is taking the helm as a chairman of the House Veterans Affairs Committee. He himself a medical doctor, he himself a veteran, and he himself someone who chose to serve on the committee as just one member of that committee in the years leading up to his selection by his colleagues as a chairman. And I know from talking with him, he has big plans, significant defined goals, and he's willing to work on a bipartisan basis to make sure that we achieve them. And I'm really looking forward to the ability to work with him. He's joined by returning members who have sought position on the Veterans Affairs Committee. Now, for those who don't know, for too long, the Veterans Affairs Committee was seen as a backwater or a basement. It wasn't a place where an aspiring member of Congress with ambitions went to do her or his work. This was a place they were relegated when they couldn't make it on to a bigger or better committee. That was the old conventional wisdom. These days, I'm proud to report, the Veterans Affairs Committee is a place of distinction where members serve with pride, where we ask to join that committee, as I did after I was elected in 2012, so we can tackle some of the most difficult challenges before this Congress and certainly this country. How we ensure that we deliver the best care to the 20 million plus veterans who have put their lives on the line and served this country in a way that no other American has, in a way that ensures that we have the America that so many of us take for granted. Veterans whose service dates back to World War II and leads up to those who are just returning from Afghanistan and Iraq and many places all over the world where we have U.S. service members stationed in more than 140 countries today. Ensuring that we fulfill our obligations to them, whether it's post 9/11 GI Bill educational and workforce benefits, whether it's access to quality, consistent health care, or ensuring that we quickly and effectively and successfully respond to claims made after there is a service-connected disability incurred in service. We need to get these things right. The future of our country depends on it. Our honor depends on it. And the commitments that we have made, the obligations that we have incurred as a country to these veterans, all that depends on our successful completion of that work. So I'm grateful for the members who've chosen to serve on that committee. I'm grateful for our chairman, and I'm grateful for our ranking member, Mr. Tim Walz of Minnesota, who also happens to be the highest ranking enlisted service member to ever serve in the Congress as a command sergeant major. Someone who has asked to be on that committee, who has written significant legislation, has ensured that the Clay Hunt SAVE Act, for example, became law, which gives us a better opportunity to reduce veteran suicide, which I think is the most critical issue that we can address, that we reduce the number of veterans who are taking their own lives and provide more resources and more help. And I will say this about Mr. Walz. He is someone who puts his country above party, the work that he has to do above his own self-advancement. And I think it is with that attitude and with that character and with the bipartisan group of House Veterans Affairs Committee members that we're going to see great work come out of this committee, great leadership come from Mr. Walz and his chairman. And I am so glad that Mr. Walz has decided to spend part of his Valentine's Day evening with me on the floor of the House talking about the great work that lies ahead for us when we try to serve the veterans of this country. With that, Mr. Speaker, I yield to Mr. Walz of Minnesota.
Well, thank you, Mr. Speaker, and I thank the gentleman from El Paso. I very much appreciate always the story and the passion that you have for that great community, and look at the leadership that comes out of there. I certainly know in your work for veterans, your name will be added to that list. The passion, the willingness to solve problems, the willingness to to find and make the tough choices to fulfill this nation's commitment to our veterans is something I am just proud to serve alongside you. And I would echo the gentleman's comments. Having had the opportunity today to witness the swearing in of Dr. David Shulkin as our next VA Secretary, being there with Vice President Pence, along with Senator Isaacson and Tester on the Senate side, and Dr. Rowe, who you spoke, I think, very accurately at, Mr. O'Rourke, a true gentleman, an impassioned advocate for veterans, and a no-nonsense legislator, exactly what we need. And to watch the sense of can-do spirit up there, to see Dr. Shulkin and his family and young children, the sacrifice that goes into public service. This is a gentleman that could make far more money and probably have a lot less headaches if he would continue to serve in the private sector. He chose not to do that for all the right reasons. And I think it probably brings us to the message that Mr. O'Rourke, that you're delivering. This is something that unites this country more than anything else, the care and service to our veterans. It does not matter your political persuasion. It does not matter where you fall on that spectrum. It doesn't matter what you necessarily think of the wars or not, or the conflicts that we are engaged in, but the care for those veterans is something that my folks in Mankato, Minnesota, and your folks in El Paso, and folks in Philadelphia and Los Angeles and Seattle and every small town in between, they want us to get it right. They want us to use the data to deliver the benefits that were earned. They want us to get it right, to show that this nation's commitment is not something that's just fleeting or comes and goes. I think most people understand this is a complex issue. Again, I was reading recently to put this into perspective. When you make this promise, when they raise their hands to serve this nation, you're in it for the long haul. And the Veterans Benefit Administration is still paying out $73 a month to the daughter of a Civil War veteran. 152 years after the end of that conflict, this nation still needs to keep its commitment. So when you go to war, it comes with a long tail attached to it, and that long tail attached is doing what President Lincoln asked us to do: care for those who bore the battle, their widow, and their orphan. And I think it's within that spirit that I would encourage our constituents, Mr. Speaker, to take an eye and look at what's happening with veterans issues, to watch when they don't believe anything can work and they believe everything's up here a fight and that we couldn't agree it's Tuesday today. That's simply not the case. We have good, smart people working for solutions to difficult problems that are in the best interest of this nation, the best interest of our veterans, and the best interest of taxpayers. I would encourage people not to make rash generalizations when people say, oh, the VA, nothing works there. That's not true. Many things work in the VA, and many things work very well. But when they don't, that's an abject failure. When one veteran is left behind or a situation like Phoenix arises, no, that's not good enough, and we can do better. But an attitude that we don't need to keep this commitment to the VA, that we don't need to do that, or somehow that we're not already using our resources in the private sector. The gentleman will, I'm sure, talk about it, but last year, 31% of all health care needs were delivered in the private sector in fee-for-service. When that makes sense, when it's most efficient, when it's most convenient for the veteran, we should deliver that. But with an understanding, the VA has a core mission to do research into extremity injuries, things that would not happen outside of industrial accidents or war. The VA needs to be there. The VA needs to be there to train physicians. The VA needs to be there to make sure that we keep that accountability instead of telling a veteran you're just on your own, good luck getting your care. It's in that spirit that I too am hopeful, and I think it needs to be said. If our constituents, Mr. Speaker, and it goes through administration after administration, whether you like the administration or not, the commitment to veterans have to be there. They've got some of it right, they've got some of it wrong. I think there's a responsibility that in the first choice of this administration in dealing with veterans, I believe they might have picked the one person in this country best suited to do the job for veterans. That says a lot, and I think it's important to stress that point. Understanding that that secretary can't do it alone, Congress writes the laws, this House authorizes the money to make that happen. We have oversight responsibility, and we have partners in our veteran service organizations who are there to help, whether it be the American Legion, whether it be the VFW, the DAV, the Iraq and Afghanistan veterans. These are all folks out there that want to keep that commitment to, want to help. And so I thank the gentleman. Again, he spoke true, and he spoke true from the heart. that at one time where people may not have seen service on the VA committee as something that was a prized position, the folks who have found themselves there are committed to this above everything. They're committed to it above party. They're committed to it above their own personal advancement. On both sides of the aisle, there's a camaraderie that is rarely seen in the press, that is rarely seen by the general public about getting this right. And I think there's much that can restore. And if anything, I oftentimes say, how we conduct ourselves in this People's House of Representatives must be a direct reflection on the sacrifice that gives us the right to self-govern. Those that paid the ultimate sacrifice were doing it so that citizens could elect their representatives to debate the issues of the day in a free and open democracy. So just the exercise of tonight of having the opportunity and the privilege to share a little of the gentleman's time on the floor was given to us at great sacrifice. We need to conduct ourselves in a bipartisan, results-oriented manner that honors that commitment. So I thank the gentleman from El Paso. I look forward to your leadership as our ranking member on subcommittees that are coming up on issues that will affect employees at the VA and delivery of care. I know they're in good hands, and as I said again, I love the stories of El Paso from such an impassioned son of El Paso, and I think your constituents should be proud you're there. I yield back my time to the gentleman.
I thank the gentleman from Minnesota and the ranking member on the full committee for the House Veterans Affairs Committee for taking some time to be here tonight and to talk about not just our challenges, but some of the hope and opportunity that we have ahead with this new Secretary for the VA, this new leadership on the committee, and this renewed commitment from this Congress and this country to do the right thing by her veterans. And I'm so glad, Mr. Speaker, that he mentioned the necessity to ensure the long-time health and viability of the VA. There has been some talk about privatizing the VA, of just essentially asking our veterans to go find their own doctors, their own medical providers in the communities in which they live, and no longer having the VA as the core of the delivery of care that they have depended on for so long. I think it's important that Secretary Shulkin, in his confirmation hearing, said that he would never be part of privatizing the VA, at least not on his watch, at least not during his tenure. While there are opportunities to capitalize on care in the community, as the ranking member said, only at the VA will we have doctors and nurses and providers and frontline staff, many of whom, by the way, are themselves veterans, who have uniquely cared for other veterans, know the signs to look for when we're trying to reduce veteran suicide, know specifically how to treat post-traumatic stress disorder, traumatic brain injury, military sexual trauma, traumatic amputations, the kinds of conditions that don't typically occur in the civilian population, that we don't see at our general private public hospitals, but are unique to the VA, unique to military medicine, where we uniquely will ensure that our veterans, our military retirees get world-class care from those who are uniquely trained to deliver that, to ensure the best outcomes. And while we should never shy from the shortcomings or the challenges within the VA, and there are plenty of them, I think it's really important to reiterate how often we are successful in seeing veterans whose care depends upon a doctor or a provider at the VA, who leaves that appointment grateful for the time they were able to spend there, grateful for the care that they received, and grateful for the fact that there is a VA. This last week on Friday, it was a few days early, but we took some Valentine's Day cards made by elementary school students at LBJ Elementary in El Paso to veterans at the VA. And I was joined by Colonel Mike Amaral, the new permanent director of the El Paso VA, formerly chief of staff at William Beaumont Army Medical Center. And we just shook hands with veterans, shook hands with frontline staff, shook hands with nurses and providers at the VA, thanking them for their service, wishing them an early happy Valentine's Day. And to each veteran either coming in or leaving the VA, I asked them what their experience was like in either making an appointment if they were on their way in, or how their appointment went when they were on their way out. And as the ranking member knows, the veterans that we represent are never shy about sharing the truth and the facts of their experience with the VA. We hear the good, we hear the bad, we hear the ugly. And at the El Paso VA on Friday, for every veteran who had been seen by a doctor, the story was a positive one. For every veteran going in to see a doctor, the story was a positive one. Doesn't mean that every single veteran's story in El Paso is positive. Let's acknowledge that some appointments are dropped. Sometimes the phone isn't answered. Sometimes an appointment is made, the doctor is not there to see the veteran. All of those circumstances are unacceptable. I know Colonel Amaral feels the way I do. I know Secretary Shulkin feels the way I do. I know every single member of Congress feels the way I do. But let's remember that the vast majority of veterans are able to be seen, are getting great health care at the VA. And for the most part, when they are referred to care in the community, when a doctor's unavailable at the VA, when a psychiatrist is not able to see that veteran for a behavioral health appointment, and they're referred to a provider in the community, most of those right now are working well. Not perfectly, not all the time. There's work before us that we must do, and it's critically important. But I'm making the point that the VA needs to remain the core of the delivery of care to our veterans. And we can add to that core providers in our communities, public hospitals, private hospitals, clinics, doctors, those who want to step up at not great profit to themselves. The rates that they're reimbursed at are just at or less than Medicare. But they do it because they want to do their part to continue to serve this country, to serve veterans who stood up, put their lives on the line, and ensured that we have the United States that we're so grateful for today. So I think that's a positive situation on which we can build with the right leadership team here in Congress, at our local VAs, and with our new secretary. I'll tell you a story about Secretary Shulkin. Shortly after he was named Undersecretary for Veterans Health Administration, I brought to his attention the suicide crisis that we have in El Paso, among El Paso veterans, in Texas, and in the United States, where we now know today, by VA's latest estimate, 20 veterans a day are taking their own lives. The old estimate was 22. It was based on incomplete data. An all 50 state basis for the new number shows us that we're at 20. Too many, unacceptable, has to become our number one priority. Unless it is, we won't reduce that number. We won't save more lives. We won't prevent more preventable deaths. I shared with Dr. Shulkin that after hearing from veteran after veteran after veteran that while generally their care received in the VA was excellent, when they were there, they were treated like a king or a queen. Too often when they were seeking a behavioral health appointment, mental health care appointment, maybe related to post-traumatic stress disorder, maybe a Vietnam-era veteran who had successfully bottled his trauma experiences for 40, 45, 50 years, was now coming to terms when he reached a certain crossroads in his life with that trauma and needed to speak to someone, that too often they were not able to get in to see somebody at the VA. And so we conducted a scientific, objective, third-party survey of veterans in El Paso. And we found, with a margin of error less than 4%, so this is pretty conclusive, that more than a third of veterans in our community could not get in to see a mental health care provider within, at that time, the prescribed 2 weeks, not within 30 days, not within a year, just not ever. And we know for a fact that care delayed becomes care denied, leads to terrible outcomes, at a minimum, unnecessary suffering for that veteran, at worst, preventable deaths, veterans taking their own lives. And so I brought this issue to Dr. Shulkin's attention. I told him that this community had rallied around our veterans in El Paso, Texas, and that the VA, the providers there, the public hospital, University Medical Center, the Del Sol Hospital, the Providence Hospital, Mentis Neurological Rehabilitation Center, another private facility in El Paso. All of these folks wanted to come together to see if they couldn't fill the gap in care and coverage that the VA was unable to meet. But we needed some leadership from the VA. We needed them to take a chance on a model that had never been tried before. We wanted Dr. Shulkin and the VHA to get behind a pilot program in El Paso that would allow us to take some of these matters into our own hands, where despite the best intentions and significantly increased funding from the VA in El Paso, we still weren't able to see veterans who desperately needed care. Dr. Shulkin reviewed the proposal with us, made some suggested changes, and within 4 months of having been sworn in as Undersecretary of VHA, was able to help us get this pilot program approved, underway, with a collaboration with Texas Tech Health Science Center in El Paso, after finding that the best performing VAs in the country are associated with academic teaching institutions. He made that partnership with Texas Tech possible. He made referring care out into the community where we didn't have the doctors in the VA possible. And he ensured that at the VA, we continue to concentrate on those areas of excellence, on service and combat-connected disabilities and conditions that we don't see in the general population, that more than anything else makes the case for the VA, for strengthening the VA, for ensuring that it's not there just today, but forever. For as long as we have a country, we have a VA that performs at the highest levels in those areas where veterans need it most: post-traumatic stress disorder, traumatic brain injury, traumatic amputation, military sexual trauma, those conditions that are unique to service and to combat. So I'm really encouraged that we have him now as the Secretary of the full VA. I'm really encouraged that we have the leadership like Mr. Walz and Dr. Rowe in the Veterans Affairs Committee in the House. I'm really encouraged by the leadership that we see on the Senate side. And I got to tell you, and I'm sure that Mr. Walz would agree with me, we have leadership out in every single community in this country, from the veterans of foreign wars, from the Vietnam veterans of America, from the Iraq, Afghanistan veterans of America, from the disabled American veterans, from the paralyzed veterans of America, from every single veteran service organization, too many to mention in the time that I have allotted today, who put the pressure, provide the solutions, make trips up to Washington, D.C., as they will this next week, to ensure that they're holding us accountable for the terrific responsibility that we have before us, and that we perform against that responsibility, and that we perform against the goals that we've set, very ambitious but achievable goals for this country and every single veteran who has served, who lives in this country, who we have a sacred obligation to today. I'm encouraged that this committee, this Congress, this country works on a bipartisan, or let's just say a nonpartisan basis, to get that work done. We're introducing 2 bills tomorrow, for example, both with Republican co-sponsors: the Veteran Prescription Continuity Act with Representative Mike Kaufman of Colorado, Representative Walter Jones of North Carolina. That bill, if made into law, will ensure that veterans who were dependent on the care provided in part through prescriptions prescribed while they were active duty service members at a military treatment facility are still able to receive those prescriptions as veterans. A lot of folks don't know this, but we don't have a unified formulary between DOD and VA. Some veterans, some prescriptions get dropped along the way. Here's a no-brainer, quick, bipartisan fix to that part of the problem. The other bill is the Mental Health Care Provider Retention Act, also introduced with Walter Jones of North Carolina. This ensures, at a time of crisis when it comes to veteran suicide, that if you're an active duty service member and you're receiving good treatment at a military treatment facility for post-traumatic stress disorder, for example, or other mental health issues, that if the VA cannot continue that care because we don't have enough psychiatrists or psychologists, we're 45,000 clinical positions short in the VA today, if you're getting good care in the Department of Defense military treatment facility and there is not that care for you on the VA side, as you transition out and separate in a given community like El Paso, that you will be able to continue to receive quality mental health care treatment at that military treatment facility. Again, this isn't going to solve every access problem. It's not going to, in itself, reduce or solve the suicide crisis we have amongst veterans, but it's a common sense, bipartisan approach that makes things a little bit better, that ensures that we have more access for more veterans and begin to take more steps towards reducing veteran suicide. Mr. Speaker, I am very encouraged today by the opportunities before us, by the leadership that is ready to take on that work, and with the opportunity I have to join these leaders to ensure that we fulfill every commitment that we have to every veteran in America. With that, Mr. Speaker, I yield back.
The gentleman yields back. For what purpose does the gentleman from Texas seek recognition?
Mr. Speaker, I move to adjourn.
The question is on the motion to adjourn. Those in favor say aye. Thank you. Those opposed, no. Oh, it's close. The ayes have it. The motion is adopted. Accordingly, the House stands adjourned until 10 a.m. tomorrow morning for the morning hour debate.